All right, Bob, I want to start from the beginning. I mean, how old are you? 59, did somebody tell me?
I will turn 60 right before I retire. So I will be 60 years old when I retire.
Where are you originally from?
I grew up in Kettering, Ohio, the Dayton area, and then undergraduate at Miami University, and then a master's in hospital administration from Xavier University with a finance concentration.
Did you start in the hospital business in
Yeah,
Cincinnati?
how I got started in the hospital business was when I was a senior in college. I was a public administration major with a minor in accounting, and your senior year you did an internship. And I was placed in the administrative area of McCullough Hyde Hospital in Oxford, Ohio. And the administrator and the assistant administrator were both Xavier grads. And they got me interested in hospital administration. However, I was engaged and I was getting married in August. My wife had an internship in Cincinnati, so I had to work while she was going through her internship, and I actually worked as an accountant for Cintas Corporation. And then the minute she got her master's degree and got a real job, then I quit and went back full-time to get my master's in hospital administration at Xavier.
Did you start with a Catholic hospital?
No, I started with a municipal hospital, which was Barberton Citizens Hospital. And I worked there for 4.5 years first as an administrative fellow, and then I became an assistant administrator. And then again, I left there and went to the Detroit Medical Center, which is a large university teaching hospital in Detroit. I was there for 2 years, and Barberton called me back and offered me a job as a chief operating officer at Barberton.
Barberton in Akron.
In Akron, and it's part of SUMA. And I came back as chief operating officer there and was there 10.5 years before I took basically the administrator job at St. Joe's, and was at St. Joe's as the site administrator for only a year. Before they moved me up to Chief Operating Officer of Humility Mary Health Partners. And I did that another 3.5 years before I became president, and that was...
So how long have you been president and CEO?
I was president in 2002, so it's been 14 years.
And it makes you the second longest president?
Second largest or longest serving CEO at St. E's.
Beat only by Sister Consolata.
Sister Consolata was 17 years, and I'm second with 14. Longest serving lay administrator.
It is kind of amazing, and I'm going to use that word, to realize that all of this was started by a group of nuns. Do you think of that?
They are amazing ladies. And even to this date, the amount of things that they accomplish and all the good that they do, not only for the Youngstown, but for the whole nation. For the whole world. They have missions in Haiti and other places. They're an amazing group of ladies.
Well, you've seen what you've done. They administered it for a lot of years.
They did. I mean, I think the first lay administrator, I believe, was around 1996. And before that, it was always run by a Sister Humility Mary.
Amazing, isn't it?
Yeah.
Your biggest accomplishments since being CEO, can you list them? Do you have any that stand out?
Well, yes. Let me back up and say what I'm proud of, and then get to maybe some of the specific.
Okay,
and I guess if I look at my 20 years here, the amount of growth that we've had is I guess the most proud of it. I look at our admissions and how much they have grown. I've looked at our revenue and how much it has grown. I looked at our FTEs. We've grown 1,400 FTEs during this period of time.
FTE?
Full-time equivalents, employees. We have basically 1,500 more people working for us now than when I started.
You are the largest employer around Youngstown.
We are definitely the largest employer. Now, you would go back and say, why have you grown? And I do believe that we've done some smart things over the years. If I were listing some of them, I guess I would start with St. E's Boardman, and that we...
Number one,
and I would say we took a field in the southern, what we call our southern market, and grown that field into a 248-bed hospital now. And obviously that's brought all kinds of business into our service, and we met the need in that area. But It also solidified the future of St. E's Youngstown here, where we're sitting today, because that's brought so many more people into our system that have needs that a community hospital can't serve, that you need a tertiary hospital like St. E's Youngstown, such as neurosurgery, open heart surgery, CAFs, level 1 trauma programs. And so it's actually solidified the future of the downtown facilities. We have 2 community hospitals, both about 14 miles from here. 14 miles to the south is St. E's Boardman, and 14 miles to the north is St. Joe's. And those hospitals send tertiary services that solidify the future of this facility in downtown Youngstown.
That was one of my questions. Youngstown, downtown is not going anywhere.
No. There was a fear when we did this, when we opened it in 2007. There was a lot of people that didn't like me because they thought that what would happen was eventually we would close St. E's Youngstown.
You can understand that a little bit, can't you?
I couldn't.
Okay.
Because this was the business plan, is to actually solidify. Look at the Cleveland Clinic. People think of the Cleveland Clinic as this massive hospital in downtown Cleveland. Well, it's a massive hospital in downtown Cleveland because the Cleveland Clinic owns 10 suburban hospitals out from the west part of Cleveland to the east part of Cleveland, and those hospitals actually feed the downtown facility. Now, we're not going to have 10 hospitals in the Youngstown-Warren area, but 2 hospitals, and not to mention there's other community hospitals that aren't owned by us that still refer to St. E's, which keeps this facility strong. Our average daily census here is approximately 300 in downtown Youngstown. Our average daily census in Boardman is 200. Our average daily census at St. Joe's is a little over 100. So St. E's is pretty much the same size as the other 2 hospitals put together. Not quite, but still roughly that. So that would be one of the major things that I would say. I think the second major achievement that I really do think that we have changed and improved the healthcare of the Valley is our relationship with Akron Children's. And that we had a pediatric program. Northside had, Forum Health at the time, had a pediatric program. It was Todd Children's Hospital. But when we did our affiliation with Akron Children's, we brought in the pediatric skills of a nationwide leader in pediatric care. And they have changed the pediatric care in the Valley through this affiliation. They run our neonatal program, both at St. Joe's and at St. E's Boardman, where we deliver babies. They run our pediatric program at St. Joe's. They have their own pediatric hospital in Warren. And they have so many more subspecialists and different skill levels that this community never had before. And I'm proud of that. The third thing, if I were just listing 3, is the amount of care for the uninsured and I guess the poor and underserved, to put it in our mission perspective. Again, it seemed like the more charity care that we did, the better our financial statements were. And believe me, I did not learn that in business school. The more free care you get doesn't usually drive you.
You didn't see that one coming.
I honestly do believe it goes back to a little bit the sisters. They had a saying, take one more orphan, and it was actually a bishop. They had this land in Pennsylvania. It was swampland. They went to the bishop and tried to get the bishop to move them, and the bishop said, no, go back to the villa, take one more orphan, and God will provide. And it seems like the more charity care, the more Medicaid we do, the better our financial results are, which is not something that they treat or teach in business school. So I can't explain it.
Well, the financial end of it has to be everything else that you've done.
Well, again, I do think we have done well in managing our resources. And when you're growing, Stan, that also helps you carry your fixed cost over more. And so, that the growth has helped the financial statements. But again, think about the amount of community care that we have done. We don't turn people away because they don't have the ability to pay. And we should be really proud of that. And obviously I am, because that would be one of the 3. When I'm leaving, and I would also say that I'm proud of this, is the people that we have here are just exceptional. And that goes from the Mercy Health executives in Cincinnati to the management staff here, to the clinical staff, the physicians, the nurses, to the people that, do the environmental services and maintenance work. There's outstanding people on this team.
Do you have any regrets, things that you wished you could have done and didn't?
I mean, when you say regrets, I could tell you that if I had do-overs, there were a few things I would have done differently, maybe sooner.
Can you be specific?
Some of them are personnel issues, where I had the wrong person in the wrong chair at some times. There's a joint venture or two that I may not have structured exactly the way that I structured. But when something hasn't worked or isn't working well, then you adapt, you modify, you change, you cancel. And I do think we have been pretty good on the things that weren't exactly great decisions or things that didn't work out well. Then you dealt with them, and you minimized, I would say, the damage or what you lost.
Now that you've been into the Affordable Health Care Act for a couple of years, are you okay with it?
I'm more than okay with it. I think it has actually helped the hospital, because what it has done, and again, I give the governor a lot of credit for this too, because again, he's a Republican governor, and the Affordable Care was not very popular with governors, because what it did is...
Especially Republican governors.
Or Republican governors, yes, specifically. Because it expanded the Medicaid program. It gave coverage to people that didn't have it before. And so a lot of Republican governors didn't do it. Correct. But Governor Kasich did do it. And what it has done is that people that had no insurance, had nothing, now have Medicaid coverage. And even though we don't cover our costs in Medicaid, the patient is not on the hook or worried about it. And what that has done, it has gotten people into the system quicker. If I had no insurance and I got a cold that ended up in bronchitis, I was going to tough it out. If I toughed it out and it turned into pneumonia, then they would show up in the hospital with double pneumonia. They would be admitted to the hospital and they would be here a week. Now, because they have Medicaid coverage, they can come in and see a primary care physician who could give them antibiotics, which stops the bronchitis, which stops the...
Never gets to double pneumonia.
Exactly.
Never gets to a hospital
And
stay.
they never need an emergency room. And that has made a difference in people's lives. And I think in the long run, it's actually cut the cost of health care more than it has raised the cut. So I am a big... Affordable Care. I think it's done a lot of good for, I'll speak for our community. It has done a lot of good for our community.
There's a lot of people that still believe that they need to go to Cleveland to get good quality medical care. Yes. Your reaction to that one?
They're wrong. Now, when I say that, if you compare our statistics on mortality, infection rates, and whatever, to the most well-known institutions in Cleveland or Pittsburgh.
And I'm talking specifically the Cleveland Clinic.
Okay, the Cleveland Clinic. We do just as well, if not better. We were the first two hospitals that achieved magnet status in the state of Ohio. The Cleveland Clinic was third. So I do think, now when I say that, there are certain things that we will never do, that you do need to go to the Cleveland Clinic.
Like what?
Open heart transplants, those types of things. There are things that you really do need, the quaternary facilities. You don't need to go to those types of facilities for your hernia or gallbladder or things to that effect.
Open heart surgeries?
We do extremely well in open heart surgeries. If I needed an open heart surgery, I would have it done here.
So even the major things, the important things, there's no reason to go to Cleveland for.
Stan, have you ever heard the definition between major surgery and minor surgery? Major surgery is when it's done on you. Minor is done on somebody else. So I think any kind of surgery could be major, including a hernia or a gallbladder. But again, we do those things extremely well, and I'm very proud of our quality statistics. I mean, if you look at, again, on the number of awards that our hospitals get, and I mean, they're from national organizations, U.S. News and World Reports, health grades, Thomson Reuters, all the different people that rate hospital and care, we do extremely well on. And we should be proud of that fact.
Why resign?
Well, I didn't resign, I'm retiring.
Okay. There's a difference?
There is a difference. There's a number of reasons why I'm doing it. One is my wife retired. She retired in June.
And she did what?
She was a school psychologist. And so she retired. All three of our kids have moved to California. We're going to be grandparents first week in March for the first time. I'll say it this way. I have some health issues. They're not major. I do think the stress of the job leads into some of those times. And I'm to the point where I'm just going to, kind of...
It's time?
Yeah, it's kind of slow down, and hopefully, like, I'm on 3 medications, and I hope 6 months from now I'll be on 1, or maybe 2, and kind of enjoy life. We have been kind of frugal over the years, and we're going to travel and see some places, and honestly, I'd like to see my kids more. We were thinking, and this got a little better last year, but in 13 I saw my one son one time during the year, and I'm not proud of that.
Are you going to stay in Youngstown?
Yeah, we are definitely, when you say that, we live in Howland, so we live in the Warren area. But yes, we're even though our 3 kids are in California, I have one in Los Angeles, one in Santa Clara, and one in San Francisco, so they're not in the same city. The price of housing in California is extremely high, and we decided that we love the area, we love our people, we love the friends, great health care in Youngstown and Warren area. We're just going to stay here.
So that was my next thing. You must like it here. If you're going to retire here.
We love it here.
You can get anywhere you want to go from here.
I can go wherever I want to go, and we both wanted to do that. I also I'm going to be on a healthcare board that so I'm still going to use some of my healthcare experience of a system in Ohio that I'm excited about. I'm on the board of Miami University, my alma mater, and 2 of my 3 kids went there. And so I'm going to be,
It takes a little work.
Yes. So I'm excited about kind of going into the next phase.
You're really happy about the way you left Mercy Health of Youngstown, correct?
I am. And I will say this. I'm proud that I could say that it's in better shape than when I came in, and that I'm basing that on our financial results, our balance sheet, our quality scores, and all those kind of stuff. So I'm proud to turn it over to good shape. I will also tell you that again, the person that I'm turning it over to, I've known he has worked for me, and there's a certain amount of relief, I guess, to know that you're turning it over to somebody that you trust and putting in good hands. And he's going to take it to even further, I guess, heights than what we are now.
Thank you.
You're welcome.